If all they think that they're getting from you is pain relief, and you've said nothing more, then guess what? When the pain is gone, or when you fail to get rid of the pain, they're gone.
Welcome to AMC. I'm Dr. Greg Miller. Have you ever thought of yourself as a teacher to your patients? Today, Dr. J.P. Whitaker is going to talk about mastering the content you provide during treatment. His point about what medical doctors and drug companies are teaching is particularly important to note. If this video is useful for you, please click the like and subscribe buttons. Let's get started.
Hey, Doc. I want to talk to you about something that I know you've heard of before, you've thought about before, but you may not realize how much you need to do it. Concept here is patient education. Now, I don't know if you realize this or not, but the word doctor actually came from the Latin word doco, which means to teach. So in essence, you as a doctor are a teacher. Now, there's three things about teaching your patients that you need to realize that you should do. And we'll look at this from the standpoint of a teacher in a classroom and common educational settings. First thing is, the teacher should always be familiar with the content. If you are trying to teach your patients about health, you need to be familiar with health. If you are trying to teach your patients how to do different things with their bodies, you need to be familiar with doing different things for your body. Now, where I'm coming from with this is concept of chiropractic philosophy. The subluxation makes a difference in overall health. Correcting the subluxation changes health for the better. But Doc, if you're not locked into that message, fat chance you're gonna teach it to your patients. If all they think that they're getting from you is pain relief, and you've said nothing more, then guess what? When the pain is gone, or when you fail to get rid of the pain, they're gone. You don't win with that deal. So make sure that you are familiar with and mastering your content. Second thing, Doc, have a plan. Teachers in classrooms always have a lesson plan. They're not going off the cuff of what they're going to teach their students that showed up that day. You should have the exact same thing going for your patients. Now, in the AMC family, we have a lot of procedures that actually help us to stay on track with teaching our patients. We have our new patient procedures, what we call the CER, Consultation Exam Report. We have a checklist. We have a 10-visit checklist. We have an expanded checklist. We have a maintenance checklist. And these are literally little lessons that you're giving your patients each and every day. We have a patient orientation class where we go through a good hour's worth of information at changing our patients' minds on what health is all about. There's a 5-point checklist that we do each and every day, 5-point visit that we do with our patients when they come in. And part of that is teaching a lesson about the hope that they can have for their own condition. There are a lot of different things that we do intentionally to teach our patients what they need to know about health. And there's a lesson that should be coming pretty much every day you see them. Now, the third thing here, repetition is the key. Now, I get it. You assume, because you've taught it before, that the patient has it down. Let's look at how you learn. Is there anything in life that you heard once that you lived on, responded to, and completely internalized from that one sitting? No. Nothing that you know right now, nothing that you've been using for the past decade or two has been something that you heard one time and it stuck with you for the rest of your days. Normally not how that goes. Now, there's a concept in teaching. They say that if your class has not learned it, then you didn't teach it. Maybe you went over the information. Maybe you gave some facts. Maybe you expounded on some concepts. But if they didn't catch it, you need to do a better job teaching it. Repetition is the best way I know of to get complicated concepts over the course of time into somebody's mind and eventually into their hearts. Now, I'm with you. I wish that everything was just like the Matrix. I could plug something up in the back of somebody's head, download some information, and it's there now. They know everything I'm trying to get them to understand. But that's just not how it goes. You have to teach people consistently, little by little, over the course of time. Now, there's something that you have to think about. Chiropractic is not widely known public philosophy. What chiropractors do is probably a well-kept secret to most people that are walking around on the planet. A lot of people think they know what chiropractors are doing, but if they haven't heard anything about a subluxation or an adjustment, then that's just it. They think they know. Now, people are responding on a regular basis to the things that they're hearing, the things that they're learning, or the things that somebody is teaching them. And Doc, I want to tell you something that you really have to think about. If you're not teaching your patients chiropractic, the medical community is definitely teaching them what they do. And they're telling them that what they do is what should be done. Think about how many drug commercials you see during any television program that you're watching. Like, this floored me one day when I thought about it. If you're sitting down watching any TV show, it does not matter what channel you're watching, at every commercial break, there's at least gonna be one drug commercial. Do you think that they don't see the value in telling a patient about what they're doing? Yeah, they are bombarding people with what they do. If you look at billboards, you'll see hospital signs all over the place. You'll see the latest drug on a billboard. If you're just going around and thinking about what's in the media on a regular basis, or if you even think about the lobbyists that are sitting in Congress, they are educating congressmen on what they do. Now, maybe at this point in time, you don't see a way for you to affect great change with the higher ups that make all the decisions, but you definitely can teach one patient at a time, one day at a time, one lesson at a time. Change their life, let them change their circle, and we can definitely make a better impact for chiropractic, for our families, and ultimately for those patients' health. Take care, Doc. I hope this helps.
Join us at our next training weekend, September 15th to the 17th. If you're new to AMC and would like a free guest pass to 3 days of material just like this, text us at 904-966-4996. AMC is your guide to becoming respected, effective, and valued in practice.